My name is Brendan Carr, and I am the Chair of Emergency Medicine for the Mount Sinai Health System. It's my pleasure today to talk about some of the frequently asked questions about the emergency department. In a medical emergency, it's really important that you do not avoid coming to the emergency department. We have seen, because people have been so afraid of coming to get health care, we have seen a lot of delayed presentations of really important medical problems, whether that be a problem with your heart, problem with your breathing, even down to a skin infection. Waiting too long when you have something that's serious can mean that by the time we meet you, we can't do anything about it. Sometimes it's too late for us to intervene in the way that we are able to intervene if you present early. So if you're having chest pain, if you're having symptoms of a stroke, if you are having anything that is alarming to you and to your family members, it's important to be evaluated. So we have spent a lot of time in the last couple of weeks making sure that we change our workflows, that we are very, very diligent about the way that we clean all the high traffic areas, and making sure that we wear masks, that we give you a mask early on in your visit to the emergency department to minimize any possible exposure to COVID. Yeah, this is a great question. This one's really important. This is always true on some level, that when you're coming to the emergency department, it's important to make sure that you have the list of your medical problems, the list of your medicines, even to make sure that you have your medicines. I would say, in the time of COVID, it's really important to bring with you a phone, a charger, so that we can make sure to be able to reach out to folks that will want to know how you're doing, so that you can have plenty of time to communicate with your loved ones about what's happening. And then maybe, the one other thing I would add there is sometimes it takes a while in the emergency department to take good care of you, and bringing a book or bringing some sort of entertainment is always a good idea. For a lot of things, you certainly can. So for lower acuity things, or things that are familiar to you, that you have been treated for in the past, that you sort of know what's wrong, or you believe it's a minor problem, it is totally appropriate to go to an urgent care center. It's totally appropriate to call your doctor's office, to see one of our doctors over a video chat. And most of those settings, if they're worried about you, they're going to refer you to the higher level of care. They're going to refer you to the emergency department if they think that you need to go. So, at the end of the day, getting emergency care, we should think of it the way that we think about all the other things that are important to do in our lives. There is risk in going outside, and that's why we're wearing masks, and why we're washing our hands, and why we're social distancing. But we go to the grocery store, we go to the pharmacy, we take care of ourselves, and going to the emergency department when you are worried that you are ill or injured is just an important part of taking care of ourselves. We're here for you, and we will keep you safe if you need us to take care of you.